Hello, I'm Dr. Andrew Mendenhall, Chief Medical Officer and Board Certified Addiction Medicine Specialist from HealthWorks Northwest. In this segment, you're going to learn about Naltrexone compressed opiate detoxification. Cassidy's story of success with the NCOD protocol followed by Vivitrol is a great illustration of what's possible using the most modern relapse prevention technology. I hope that you will find something in this story that will help you or a loved one in your path of recovery. Cassidy, thank you so much for being here today. Would you be willing to share with our audience about your history with drug and alcohol addiction?
When I was 16, I tried black tar heroin, and my boyfriend had introduced me to it. I fell in love with it very quickly, and that drug just sucks you in and makes you instantly a weak person. It crumbles you.
At what point did you notice that you were into your addiction very deeply?
I smoked it for about 8 months, and then I started shooting it up. I started using a needle, and after that point, it went nuts. I just got deeper and deeper and deeper into the drug game.
They started you on Suboxone, and it helped you in your detoxification. Did it help you stay clean and sober over the long haul?
No. It was very sufficient on, not making me sick, or it worked great for what it's for. It's just I can't have the choice. I would wake up in the morning and be like, okay, should I take this little pill or should I get high today? My mind I wasn't ready for that. It didn't click because I can't have the option. That drug is so powerful over me. Buprenorphine was definitely the key for me, I thought, but no. I was on Suboxone for, about 8 months.
Upon your discharge and prior to your relapse, you had been clean for just shy of 3 weeks. Did you feel that you were at risk for overdose if you did relapse?
I did overdose after I relapsed. After I got out of rehab and I relapsed, I did overdose about 4 days into my relapse. But yeah, I hurt very high risk, and it was the scariest thing that I have ever been through. I've definitely seen it happen, and it is always very scary to see somebody overdosing, but it just really made me wake up, like, oh, you were almost dead last night. It just, makes me very thankful to have the life that I have now.
Do you remember why they turned you away when you had relapsed and you asked to get back into treatment?
Yeah, I was a little angry because I was scared. Nobody likes heroin withdrawal, and the rehab that I'd gone to would not accept me back. And so we came into your office because I was like, well, maybe if I just detox myself, I'll get right back into the swing of things and I'll just be clean again like I was before. The buprenorphine had always worked, and I came into your office and you were telling me that I could not have buprenorphine, and I was like looking at this list, all this medications I did get, and I was like, I don't know what any of this is. I was freaked out. I didn't think it was going to work. I was like, I am going to feel like crap for, who knows how many days, until I'm done detoxing. I remember getting that terrible feeling in my stomach, like, oh gosh, it's only begun. But I was so surprised because it worked. It all worked. My withdrawal was nothing that I'd ever experienced before. It was, so minimal. It worked.
We are both very indebted, you as a patient, me as your treating physician, to Dr. Stephen Marcus, who came up with a protocol for Naltrexone compressed opiate detoxification. This protocol in combination of medicines is what has helped keep your brain calm and your body calm through your detox process.
It's amazing. I'm so blessed and so thankful to be guided down this path. I'm so happy.
It's been my observation that through the use of Vivitrol, that there's a restoration of trust that can occur inside of families. What do you think?
There's no wishy-washy relapse in between this. There's none of that not knowing what's going to happen. It eliminates the cravings. I mean, I really don't crave it. It's just that assurance that there's no way that I could get high or that I wanted to, you know?
What would you say to somebody, Cassidy, if they think they're ready for help?
It's so doable. I was on the fence for, you know, over a year. I don't know how many nights I stayed up bawling because I just didn't, you know, I just didn't think I could do it. I just didn't think there was, you know, I'd been failing so much. I'd been trying, and it's amazing. I'm so blessed and so thankful to be guided down this path. I'm so happy to have my life back and to be free. I never feel that complete panic that I used to live with every day of, you know, how am I going to get well? How am I going to stay well? Where am I going to sleep? You know, there's a solution. There definitely is a solution. And it's awesome. It's awesome. I wouldn't trade it for anything. I really appreciate it.
Buprenorphine, which is the opiate in Suboxone, doesn't tend to address the craving that is present in many opiate-addicted individuals. It's extremely satisfying to not have to use an opiate to help somebody completely detoxify and land with the safety of a once-a-month relapse prevention medication. Through the process of Naltrexone compressed opiate detoxification, based on the work of Dr. Stephen Marcus, Cassidy's success is an illustration of what is possible with NCOD followed by Vivitrol induction for longitudinal recovery medicine support. On behalf of all of us here at HealthWorks Northwest, we thank you for watching.